We have who will recite verses of Quran for us. Mr. Umar, please come to the podium.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والشمس وضحاها والقمر إذا تلاها والنهار إذا جلاها والليل إذا يغشاها والسماء وما بناها والأرض وما طحاها ونفس وما سواها فألهمها فجورها وتقواها قد أفلح من زكاها وقد خاب من دساها كذبت ثمود بطغواها إذ انبعث أشقاها فقال لهم رسول الله ناقة الله وسقياها فكذبوه فعقروها فدمدم عليهم ربهم بذنبهم فسواها ولا يخاف عقباها तर्जुमा। कसम है सूरज और इसकी धूप की, कसम है चांद की जब इसके पीछे आए, कसम है दिन की जब इसको नुमाया करे, कसम है रात की जब उसे ढांप ले, कसम है आसमान की और इसके बनाने की, कसम है जमीन की और इसके हमवार करने की, कसम है नफ्स की और इसे दुरुस्त बनाने की, फिर समझ दी इसको बदकारी की और बच कर चलने की। जिसने इसे पाक किया वो कामयाब हुआ और जिसने इसे खाक में मिला दिया वो नाकाम हुआ। कौम समूद ने अपनी सरकशी के बाइस झुटलाया। जब इनमें का बड़ा बदबख्त उठ खड़ा हुआ, उन्हें अल्लाह के रसूल ने फरमा दिया था कि अल्लाह ताला की ऊँटनी और इसके पीने की बारी की हिफाजत करो। इन लोगों ने अपने पैगंबर को झूठा समझकर इस ऊँटनी की कूंचें काट दी। बस इनके रब ने इनके गुनाहों के बाइस इन पर हलाकत डाली और फिर हलाकत डाली और फिर हलाकत को आम कर दिया और इस बस्ती को बराबर कर दिया। वो नहीं डरता इसके तबाहकुन अंजाम से। सदक़ल्लाहुल अज़ीम।
So, the prestigious guest, this is my pleasure to welcome you all the expert participants of the 22nd Cancer Symposium, an enlightening and exciting educational event of its kind. In the same event, Oncology Nursing Symposium bring together dedicated health professionals from the national and international institution to highlight the crucial role that nurses play in the battle against cancer and in general healthcare system. This symposium aims to inspire, educate, and empower the nurses to continue their invaluable contribution in providing exceptional care to the cancer patient. So the theme after we have two sessions. One is today, which is from 8 10:30 to 10:30, and we will have another session tomorrow, which will start at 9. And we aim to start our session and finish our session on time so that we can smoothly run our program. So the theme of the session today, which is session 1, is nurses, a leading force to fight against cancer. This session will facilitate nurses to explore the latest breakthrough in treatment, technology, and approaches in managing cancer patients, and gain insight into the evidence-based practices that enhance patient care and patient healthcare outcomes. The session tomorrow will be about our nurses, our future. So recognizing this notion that nurses are the future of healthcare system, not only in Pakistan, but globally, we hope to inspire and empower them to be at the forefront of advancement in healthcare system in general and in cancer care in particular. So we invite nurses from all background levels of experience to join this Oncology Nursing Symposium. So together, let's celebrate the incredible work of nurses to fight against cancer and explore the way further. I hope you will enjoy both the session and the day overall. So to initiate our plenary talk, our first speaker is Ms. Rehana Panjwani, the pediatrics oncology specialist nurse, have been working for ages in oncology setup. Currently, Ms. Panjwani is working as a director of nursing in Dow University Hospital, but she is attached to the oncology setup nationally and internationally. Please welcome Ms. Rehana Panjwani.
Thank you so much, Jahana. तो हम नाम है. मेरी presentation, please. Thank you so much. So my topic is boundless professional scope in oncology, right? So, and my job is also to inspire you to be an oncology nurse. And why are we here? And why do I want you to be really, really proud that you are working in oncology? So we are going to go through some of the aspects of oncology nursing that probably you all know that, but it's just that we are sitting here, so we are going to contemplate more on that and understand that why are we important in nursing care, right? So I passed through some barcode, but I'm so sorry, it seems like it's not going to be practicalized, but I'm going to do the same thing by show of hands. Okay, सो शो ऑफ हैंड्स ऐसा होगा कि मैं सवाल पूछूंगी, आप लोग हाथ उठाएंगे एंड मुझे अंदाजा हो जाएगा कि कौन क्या बोल रहा है, राइट? इज दैट ओके? सो वी विल सेव टाइम देयर. सो कैन यू, आप लोग वो हाथ, वो लोग, कैन यू प्लीज रेज योर हैंड्स, द पीपल हु आर वर्किंग इन करंटली इन ऑन्कोलॉजी, जो कैंसर ऑन्कोलॉजी केयर में काम करें, वो अपना हाथ उठाएं. हाउ मेनी पीपल? सो अबाउट 70% here, right? I may be right, may be wrong, right? Including me, 72%, because I'm big, right? So the next question is, how many years of experience do you have in cancer care? 2 years wale haath uthaएं. 4 years? 6 years? More than 6 years? Oh, so that means that less than 2 years, more people are from, under 2 years of experience. Is that true? Yeah. So now I know my audience correctly. So we were supposed to do this on like interactive way, but this is better. No, now I know. So what are your credentials? How many people are just, BSc in nursing, post-RN generic nursing, कितने लोगों ने किया है? MSc in कितने लोगों ने किया है? Right. So it's like, और पुराने लोग जैसे हम जैसे लोग post-RN वाले कितने हैं? Say. So it's like I have an audience who are like new generation, which is also called Gen Z, जो अभी अभी आए हैं इधर oncology में. तो I think it's a good audience to understand कि oncology में आपका career क्या कहता है, right? or why are you in oncology, and try to understand that why are we here, right? So I'm just going through the next question on my. So anybody has done any specialization over the past few years? जैसे कि आप लोगों में से बहुत कम लोग 2 साल, I mean mostly people are like less than 2 years of experience. Specializations अगर किसी की हैं, 1, 2, आपकी specialization in oncology. Awesome. So there are other people who have not done any specialization. कोई midwifery भी नहीं किया है किसी ने? Because that also comes under a specialization. Okay. So we'll talk about that. Right? How many people want to aspire this career as like मुझे oncology nurse ही रहना है? मतलब अब तो मैं बदलूंगी भी नहीं, 20 साल से ऊपर हो गया. दो रहना तो नहीं बदलती. तो like 30%. So अगर after the end of this session, if I inspire you all, at least 10% more people, that would be great. We'll have a bigger force, Rehana. So I have a mission. Right? So now the another question is very sensitive. How many people here sitting right now have had any experience with cancer in their personal families? कितने लोगों ने experience किया है cancer अपनी family में, close relatives? Oh, so this is about 40%, I guess, right? That is huge. Don't you think that people around here are like 50 people here? उसमें से 40% लोगों ने cancer experience किया. And again, your close family members. So, you need to understand that International Agency for Research for Cancer कहता है कि 1 in 5 people will develop cancer in their lifetimes. Like every 1 in 5 people around here will develop cancer in one way or other, or one other cancer. 1 in 8 men and 1 in 11 women die from disease. So this is how big the cancer is. 50 million people will be living within 5 years of a past cancer diagnosis. Like imagine the scope, so many people. And now come to cancer mortality, which is like another part of us, which is like hum lower middle income countries. So like we are in a very lower middle income countries, there are middle income countries and there are higher income countries. So the population based, like the population states that we are more densely populated. जितने lower middle countries हैं उनमें population ज़्यादा है, तो कैंसर भी ज्यादा है, क्योंकि जब पॉपुलेशन ज्यादा होती है तो कैंसर भी ज्यादा होता है. तो जब कैंसर होगा तो मोर्टेलिटी भी देखेंगे. वी विल एक्सपेक्ट द मोर्टेलिटी, लाइक कितनी डेथ्स हो रही है. तो इफ वी सी दैट इन LMIC एंड MIC, इन मिडिल इनकम कंट्रीज एंड लोअर मिडिल इनकम कंट्रीज, 72% to 75% देयर इज मोर्टेलिटी, यानी कि इतने लोग कैंसर होता है और दे डाई. बट इन हायर इनकम कंट्रीज इट्स 46%. So imagine the difference, and why we are important, and why this meetings, the symposium is important, because we need to decrease the gap bit of mortality. जहाँ 75% mortality है, 46% mortality, we want to decrease the gap. We want to make sure कि अगर वहाँ 75% लोग बच रहे हैं तो पाकिस्तान में क्यों नहीं बच रहे? This is a food for thought. हम सोचते हैं कि क्या problems हैं, क्या issues हैं. So we know few problems, but just a bit of history. That oncology nursing was started in 1940. 1940 में यूएसए ने सोचा कि हमें ऑन्कोलॉजी नर्सिंग को शुरू कर देना चाहिए, मतलब इसको सब स्पेशलिटी बना के हमें काम करना शुरू चाहिए. 47 में फर्स्ट यूनिवर्सिटी कोर्स वाज स्टार्टेड इन कैंसर केयर. कोलंबिया यूनिवर्सिटी ने शुरू किया. 1950 में they started, the full impact of cancer was starting to be realized. They understood that, this is something we need to invest in. We need to invest in education. We need to, train more people. And this is something we need to do. And period between 1950 and 1980 was a time of erratic but fundamental changes in every arena of nursing. So 1950 से 1980 तक it started developing, evolving, and more refining. And presently, rapid change of the role of oncology nurses evolved from primary task givers, यानी कि अब सिर्फ हम vitals नहीं लेते, but it is more scope is increasing a lot. So we are going to know about that also. So what are the challenges national wise? हमारे पास cancer control plan नहीं है. If you understand that why is it important for being a nurse, a cancer control plan, I didn't know much about cancer control plan like 4 or 5 years back, but then I started to understand that, internationally it's very important to have a cancer control plan. हमारे पास एक plan बना था for prevention of, non-communicable diseases. And I had another slides, but I had to remove it. And there is one chapter on cancer care, which is like around 26 to 30 pages का सिर्फ एक cancer care पे chapter है. Only one chapter. और उस chapter के अंदर भी pediatric oncology का सिर्फ एक less than 500 words का एक paragraph है. So I went through it, I read it. The reason was because I wanted to know what does it say about nursing. And unfortunately, the non-communicable disease plan does not have anything about nursing, not a single word, right? So we are not there. And when I look at the other cancer control plans in other countries, they have specific things for cancer, like there's a specific cancer plan. It's a state plan. And there are few pillars which are important in cancer control plan, which is center of excellence. And how many centers we have? Is there universal health coverage? क्या universal health coverage मिल रही है नहीं मिल रही है? क्या regimes for treatment आपके aligned है या नहीं है? एक universal reach, or what is the method for evaluation and monitoring? So these are the basic of cancer control plan. So we don't have that. We don't have population-based national cancer registry, and this is sad because all the data we get, and that data is the language spoken these days to describe what is happening in the world. अब जब हमारे पास कोई data ही नहीं है population based, तो everything is estimated. I showed you data from IARC. यानी कि अगर हमारे पास कोई एक data नहीं है तो वो estimate करते हैं. शौकत खानम की अपनी registry है. So now we are getting data from that. Other hospitals have other registries, but they are just hospital-based registries. We don't have a national population-based registry which will show us true picture of cancer and true picture of mortality. So everything is estimated from that through the estimation of population. और अब हमारी population कितनी हो गई है? 24 million, right? So that is a big, huge population, and we need to understand the scope of that. So another problem, we were just discussing right now, nurses don't have visibility in national organizations. हमारी nurses national organizations में नजर नहीं आती है. हमारी societies नहीं है nursing की. जब हम इतना oncology देख रहे हैं तो हमारी oncology nursing society पाकिस्तान की किधर है? अच्छा वो तो नहीं है. Apart from that, where is our visibility in other organization which is already exist, like adult oncology की organization? Pakistan Pediatric Oncology की जो society है, Pediatric Society of Pediatric Oncology, there is nursing visibility because I was there from the beginning of its, conception. मैं शुरू से वहाँ थी. And why do I say that we have to make sure that we are there? Because visibility is important. Like Pediatric Society of Pediatric Oncology, PSPO is right now working on developing a national cancer control plan with WHO. वो pediatric का cancer control plan बना रहे हैं. If I am there, I am right there. I am there to push the nursing agenda there, right? If there's no presence of nurses, there will be no nursing portion in that. So this is why you need a seat at the table. You need to be there. So this is why these societies are important to push the agenda of nursing. हमारे nursing issues हैं, हमें nursing को आगे करना है, grow करना है. And this is how they developed. They started things in 1940. Did you see the history? And we are still, what do you think we are? We are still at the base. I think we are not yet have started that. And with this, I propose Shaukat Khanum to take the lead and start nursing society for pediatric oncology. Now come to nursing education, right? In oncology nursing education, they started in 1950. The University of Columbia started courses. And I'm really grateful to Shaukat Khanum who started the oncology diploma, right? It was like 15 years back, 20 years back. Imagine. They started, and this is the only organization running now. We have pediatric oncology diploma, which was started in 2009 by Indus Hospital and Health Network. But these are the only two organizations with such a huge population, with so many cancer cases. Do you think it is enough? I say no. We need more people to understand cancer care. It's a complex care. And, the more we understand, we are going to treat them better. It's not just particularly khali dawa lagani hai, dawa laga ke chale jana. It's not just that. There's a whole science involved around that, and we need to learn that. And then we don't have certifications. Like if you go around in Western countries, they have CFON, they have pediatric oncology nurse, oncology diplomas, they have certifications in bone marrow. I mean, you know, they have multiple certifications. कोई ऑन्कोलॉजी सर्विस में काम नहीं कर सकता जब तक उनके पास ऑन्कोलॉजी का डिप्लोमा ना, आई मीन सर्टिफिकेशन ना, लाइसेंसर ना. हमारी पीएनसी को भी चाहिए कि वी स्टार्ट सम लाइसेंसर. Like we are working with cytotoxic drug, we are working with very vulnerable population, and how trained are we? है ना, शुरू तो हमसे होना है. So we have to start somewhere. So this is a leadership job. This is our job to push this agenda forward. And this is why I say that visibility is also important, that because you are there in the agency, you are in their societies, you are going to push the agenda of oncology. So why, I mean, you know, what is the really task of nursing? So I read through this as an article from my very good friend, Julia Chalnar, and she kind of described it that, you know, different stages of cancer care and where nursing is completely, you know, important and indispensable. It's like every stage, right? From prevention to palliative care. You name every stage and there is a role of nurses. Unfortunately, we have limited scope. हमने अपना scope छोटा कर दिया है. But we need to widen that scope. And how? We are going to discuss that. But this is all places where nurses are valuable. In high income countries, just look at how different we are working, right? In high income country या western country जो हम बोलते हैं बाहर के मुल्कों में, they are nurse practitioner, and let me tell you, there are nurse practitioners for every particular field. वहाँ पर invasive procedures भी nurses करती है, आपकी chemo nurses भी होती हैं, leukemia nurses भी होती हैं, and they are like specialized nurses, right? Then navigators are like they're professional navigators whose job is just to make sure that patient ka agar radiation hai, so he goes there to the radiation on time and, you know, schedules everything. If there's biopsy, they schedule everything, and they're with the patient from the beginning, helping them out navigate all the complex healthcare systems. Advanced practitioners hote hain, nurse researchers. I mean, and I'll tell you later what nurse researchers, then clinical nurses, and then education as another domain. और LMIC में हम क्या कर रहे हैं? हम सिर्फ बेडसाइड नर्स करते हैं, या नर्स एजुकेटर हो गई, या नर्सिंग मैनेजमेंट हो गई. दिस इज ऑल वी नो. ठीक है, अगर किसी ने मास्टर्स कर लिया तो उसके 2 टारगेट है, राइट? या तो वो बाबू बनने बैठेगा, मैनेजमेंट जॉब. इवन BSCN करके लोगों को ये लगता है कि मैं बेडसाइड क्यों करूं. बट ट्रस्ट मी, आई डिड observership in Western countries and with many oncology seniors, and they love bedside nursing. PhD pain management nurse bhi thi, palliative care nurse bhi PhD thi, and they did PhD and they were there on the bedside. Chemo nurse palliative care thi, bone marrow nurse PhD thi, and they were all doctorates, but they were in clinical area with the patient. So this is how important you is. I mean, you know, you just don't make sure. I mean, you know, the mindset कि हमने bachelor's कर लिया, master's कर लिया, तो हमारा scope या तो सिर्फ academia में, या हमारा scope इधर है. So just widen up. Clinical side पे बहुत जगह है जो कि खाली पड़ी है. It's unpaved ground. वो बोलते हैं ना खाली खेत पड़ा हुआ है. I mean, you just have to pave the path. So the China did this. I read across this article and it was very good, and they did this wonderful analysis of their country, and they said, okay, where are the domains that nurses should work and what are the strategies they should work to improve those nursing. So I'm not going to go in detail, but you can get the slides or article from the link and read it. It was a very well read, you know, it's a good read if you want to. So let's come to the point. अब जब मैं बहुत दफा बहुत सेशंस लेती हूँ तो बहुत सारे लोग बोलते हैं हम क्या कर सकते हैं, we are just nurses. So let me tell you, how can we do? So prevention, let's come to the prevention. What can we do in prevention? हम क्या कर सकते हैं? So the literature says that the oncology nurses' influence in saving lives through prevention and early detection of cancer is noteworthy. Like, you know, इसका कोई मुकाबला नहीं. हम क्या कर सकते हैं? I'll present you three of the case studies. A clustered ये एक randomized trial was done in India. 8 registered nurses did the 3 week of training. The intervention group participants were invited for a scheduled visual inspection of the cervix with acetic acid, VIA, When compared with the control group, the intervention group reported a significant 25% of reduction in the incidence of cervical cancer. These were nurses. They initiated that. And then Oman. This is another case study I always share, and I love Oman ki case study. Why? Because they had a very unique idea and I loved it. I used to go, because I was associated with the Oman Cancer Association. I used to travel to Oman a lot. So first time when we went to Oman, the Oman ne hame case study present ki, and they had the same problem, and they kind of dissected it, and they said that the late diagnosis is our cause of high mortality. So in breast cancer. So what they did, they started a campaign. Campaign ke andar unhone ye kiya ki every school, like, above 7th grade, and colleges, they started a self-breast examination and breast awareness session. And we were in the audience, like जैसे आप बैठे ना, हमने सोचा कि ये इस ग्रुप को क्यों टारगेट कर रहे हैं? Why are they targeting this group? इसमें तो breast cancer नहीं होता, 40 plus को होना चाहिए. And then we were like curious, and we asked, don't you think the targeted population is not right? And the answer was very, very, very good. And they said, and they have the same culture. ठीक है, ऐसा ही कंजर्वेटिव कल्चर है, नानियां दादियां बाहर निकलती नहीं है, ब्रेस्ट पे लंप हो जाए तो किसी को बताती नहीं है, पर्दों में रहती हैं. तो the reason was very interesting. They said that we are targeting this population because when they go home, they have their grandmothers and mothers, and they can help them identify breast cancer, and then they can help early recognition, and they can bring them to the hospital and healthcare. They also said that meanwhile doing this, they will also be trained to do self-breast examination and understand what breast cancer is. And, let me tell you, interestingly, after 10 years, when I met them again, they showed the data, and data had significant reduction in late diagnosis. Voila! Wow, those were nurses. Can't we do that? हम कर सकते हैं ना? हम अपने मोहल्लों में जाके टीच कर सकते हैं, कैंसर के अर्ली डायग्नोसिस पढ़ा सकते हैं. हम नहीं पढ़ा सकते. हम अपने चर्चेस में, this is what I teach everybody, that every individual has a role. You go to your family milad hai, family function hai, take out 5 minutes. Ask them, I want to share a few information, which is important for you. Because if every woman, 1 in 8 women will get cancer in their lifetime, they need to understand, don't they? And if in 1 in 5 men, 5%, itna zyada frequent cancer hoga, to don't you think we need to know what the early diagnosis is? And this is where prevention may our role. The another case study is from Tanzania. Tanzania, one of my friend, she received a grant, and she led a project to train community nurses for early warning signs in pediatric cancers. उसने खुद किया, उसने community nurses को teach किया ताकि वो जाके उनको बताएं. Clinical practice, I told you before, bedside comfort care अकेली एक चीज नहीं है, but nurses are performing bone marrow aspiration, biopsies to interventions, everything. But let me tell you, there is a licensure and there is credentialing needed for that. ऐसा नहीं कि अभी मैं बोल दिया तो जाकर सब जो है ना वो bone marrow aspiration मैं तो करूंगा bone marrow aspiration. It's not like that. You need to be credentialed, and you need to have your license. Academic में there's a big scope. You can have CNEs, you have starting program, and you can start with your own self. आप अपने अंदर शुरू करें. आप कहें कि मैं रोज CNE शुरू करूंगा, 1 घंटे की रोज पढ़ाऊंगा, या वीक में 1 दफा मैं पढ़ाऊंगा, and I'll talk about this topic. Start that. You can do that. Nurses can do that. Can't you? I mean, we all can do this. And then societies, I told you that we have to. And then research. You have to understand there's a huge role in research. हमारे पास research नहीं होती है. Few of my friends are exclusively working in nursing research. काटी में काम करी, and I tell them, मैं consensus meeting में गई थी 2017 के अंदर, वो nurses led था. Consensus meeting था, वो symptom care पे consensus कर रहे थे. And I was so impressed. I said, they are way ahead. हम तो अभी symptom assessment ही नहीं करते. वो consensus meeting कर रहे हैं symptoms पे. And we are way behind. So when are we going to pick up the pace? So the cancer management is an interdisciplinary endeavor. Thus, an understanding of the principle of oncology nursing is fundamental to the effective practice of oncology. Nurses are engaged in collaborative practice with all members of the healthcare team. We are an integral part of the healthcare team. As a cancer care evolves, so do we now opportunities for nurses' role. Oncology nurses in any role provide essential nursing care. As a starting point, effective oncology nurses can only be provided with a robust oncology workforce. And this is the workforce we are talking about. So this is my last message and this is my last slide. If you can't do big things, do small things in a great way. In every individual of you, start doing something to promote. And, there's role in every aspect from prevention to palliative care. And then you have to identify where you can give contribution and start giving a small contribution. Small steps will make a force. आप करेंगे, मैं करूंगी, हम सब मिलके करेंगे, then we will develop oncology जो 1940 में या 50 में वहां थी, हम आज यहाँ पर अभी भी 2023 के अंदर भी 1950 में हैं जो वहां आगे निकल गए, तो हमें भी तो पेस पिक करना है ना. So this starts with you all and I think you are going to do it, inshallah. Thank you so much. So I hope I ended in time. Thank you.
Thank you, Rihanna, for such an enlightening talk. And it is very well stated that oncology nursing has boundless professional scope. I'm confident nurses in Pakistan and nurses sitting here in this hall have a lot of talent to grow in this specialty. And it, as we said, that is a boundless scope. So it is actually boundaryless scope wherever you work. So you can work for your nation, you can work for your specialty, you can work for your passion. So Amir will announce the next speaker.
Assalamu alaikum. Our next talk is on patient engagement in the digital age, the impact of digital therapeutics in cancer care. It is a virtual talk. The presenter is Dr. Neelam Salim Panjani, Assistant Professor in University of Alberta, Canada. She could not join us due to some personal issue. She is virtually connected.
Good morning and assalamu alaikum. My name is Dr. Neelam Panjani and I am the Assistant Professor at the University of Alberta. Today I am presenting about the patient engagement in the digital age, the impact of digital therapeutics in cancer care. So I'll be talking about the prevalence of cancer diagnosis, introduce about what digital therapeutics is, its purpose, principles, and the importance. We'll also talk about how it can improve the healthcare, what are the role of the nurses, because that's something that is very important, and we'll share some. So worldwide, the cancer burden is increasing, putting enormous physical, emotional, and financial pressure on people, their families, communities, and the healthcare system. Many health systems in low and middle income nations are unable to handle this load, especially if we talk about Pakistan. And many cancer patients throughout the world lack timely access to high quality diagnosis and treatment. According to the World Health Organization, cancer is the second most common cause of death worldwide, accounting for 10 million fatalities in 2020, or 1 in every 6 deaths. Researchers project that by 2040, low and middle income nations would account for more than 2/3 of all the cancer cases worldwide. So what is digital therapeutics? It delivers medical intervention directly to the patients to prevent, improve, manage, or treat diseases. They are evidence-based and clinically evaluated softwares. It is also important to understand what's the difference between digital health versus digital medicine and digital therapeutics. So digital health only captures data, storage, and display for care provision and management, whereas digital medicine is the use of digital technologies as tools for the measurement and intervention in the service of human health. However, digital therapeutics is different because it delivers interventions to prevent, improve, manage, and treat diseases. So let's understand the history of digital therapeutics. So since 1995, the word technology-driven care was coined by Joseph Cavender. And then in 1999, the term e-patient was coined by Dr. Tom Ferguson. In 2000, their publications started to come in about the digital products, whereas the formal word for the digital therapeutics started in 2012. So as discussed earlier, The Digital Therapeutic Alliance is the delivery of the evidence-based therapeutic intervention, and we try to prevent, manage, treated medical disorder or diseases by using some kind of a software. It can be used independently or in combination with different medication, devices, or other therapeutics to optimize patient care and health outcomes. The products that we use are usually reviewed and approved by the regulators to supplement the product claim regarding risk, efficacy, and intended use. And these products are usually clinically validated, they are rigorous, they are focused, and they are also FDA approved. So it is very important to understand how does digital therapeutics work. An effective digital therapeutic begins and ends with data. When a patient receives a digital therapeutic, the program collects feedback on practical, emotional, social, and physical challenges to provide personalized patient partner data framework for sending care messages specific to the patient's medication, the monitoring of side effects, and the encouragement of healthy lifestyle choices. But again, this is not a one-way street. Throughout the cancer journey, patients are encouraged to interact with the program by entering day-to-day concern or their needs. The two-way interactive ability of the program collects the patient-reported data and can triage a patient to the appropriate team members when any kind of the adverse event is identified as potentially imminent or is reported to have occurred. There are different kinds of diseases or disorders that can be managed through digital therapeutics, such as chronic diseases, for example, cancer, personalized health coaching, neurological disorders. For example, we can provide online self-care programming that can be online. Substance addiction, digital applications of cognitive-based therapies, and medication adherence via mobile apps, AI, or pill sensors. As we all know that there are so many benefits of using the digital therapeutics, however, there are some barriers in the adoption of digital therapeutics. These barriers can include difficulty in distinguishing between digital therapeutics from more general health and well-being applications in general digital health market. It can also increase in physicians or healthcare workers burdened by data overload, and it can also be difficult to separate unproven or low-value applications. Digital therapeutic has proven to be very, very important, particularly during and the post-COVID era, because it has provided benefits of providing teleconsultation, remote patient monitoring and improving patient adherence to the treatment, could base patient data management and sightless clinical trials that can be done online. Nurses play a vital role in digital therapeutics within the context of cancer care. Digital therapeutics in cancer care encompasses a range of technologies and intervention designed to support cancer patients throughout their journey, from prevention and early detection to the treatment, survivorship, and palliative care. Here are several key roles that nurses fulfill in the realm of digital therapeutics in cancer care. Nurses play a crucial role in educating patients about available digital technologies and resources. They also empower patients by explaining how these tools can assist with symptoms management, treatment, adherence, and overall well-being. They also help patients to understand how to use apps, wearable devices, or online platforms to monitor their health and communicate with their healthcare team members. Nurses can also help in the assessment and symptom management via digital therapeutics. They use digital tools to assess cancer patient symptoms, side effects such as pain, nausea, fatigue, and emotional distress. Digital therapeutics can include symptoms tracking apps and wearable devices that collect data in real time. Nurses interpret this data and collaborate with the healthcare team members and adjust treatment plans and provide timely intervention. Nurses can also help provide treatment adherence support. Ensuring patients' adherence to their cancer treatment regimens is crucial for successful outcome, particularly for cancer patients. Nurses can use digital therapeutics to send medications reminders, provide educational materials, and track adherence. They can also address any concerns or barriers to adherence that patients may encounter during the treatment. Digital therapeutics also help in the telehealth and the remote monitoring. Nurses can conduct telehealth consultation with cancer patients, especially those in the remote and underserved areas. Through video conferencing and remote monitoring, nurses can assess patient condition, they answer questions and provide emotional support to patients. They also have the capability to monitor vital signs and treatment responses remotely, enabling timely interventions whenever it is needed. Nurses can also provide psychological or psychosocial support to patients. The emotional and psychosocial aspect of cancer care are paramount. Nurses use digital therapeutics to connect with patients with support groups, mental health resources, and apps designed to reduce anxiety and depression among these patients. They also provide counseling and emotional support through virtual platforms. The other uses of data therapeutics can include data interpretation and clinical decision making. Nurses are skilled in interpreting complex healthcare data collected by digital tools. They use this data to make informed clinical decisions such as adjusting pain management strategies, modifying treatment plans, or recommending supportive care interventions for a patient. Digital therapeutics can also help in the coordination of care. Cancer care often involves multiple healthcare providers and services. Nurses help coordinate care by ensuring that data from digital therapeutics are integrated into the electronic healthcare records and shared with the entire healthcare team. They facilitate communication among oncologists, radiologists, surgeons, and other specialties that are involved in patients' care. Digital therapeutics also help nurses to be a great advocate for their patients. Nurses advocate for the needs and preference of cancer patients when it comes to using digital therapeutics. They provide valuable feedback to healthcare organizations and technology developers, ensuring that these tools are patient-centered and user-friendly for all the patients. Given the rapid evaluation of digital therapeutics in cancer care, nurses must stay up to date on the latest technologies and evidence-based practices. They participate in ongoing training and professional development to enhance their digital literacy and proficiency. Last but not the least, research and evaluation. Nurses contribute to the research and evaluation of digital therapeutics in cancer care by participating in clinical trials, assessing the impact of these interventions on patient outcomes, and publishing their findings into the nursing journals. In the future years, oncology will undergo substantial changes with new IT and healthcare technology, enhancing the potential to customize cancer therapies to unique individual patient profiles and provide more personalized cancer care to patients. Given that, some components of healthcare will likely never be totally replaced by technology. Digital therapeutics is likely to be used in tandem with other treatments to improve patient outcomes. Thank you so much for your time and attention.
So, thank you so much, Dr. Neelam, for bringing this innovative aspect of healthcare, especially nursing care. And as it is said that our young generation is Gen Z, and that's the digital generation, they can use advanced technology in providing care to the patient and enhance, and they can bring better patient outcome as compared to the past.
So our next speaker is Amir Abdullah, Assistant Director of Nursing, Shaukat Khanum, Peshawar. And he will be talking with us regarding nurses' intervention to promote patient engagement in cancer care and its treatment.
Okay. Assalamu alaikum and good morning. My name is Amir Abdullah and I am working as Assistant Director in Nursing in Shaukat Khanum Memorial Cancer Hospital. For today, my topic is nursing intervention to promote patient engagement in cancer treatment and care. These are the outline for today's presentation, which is Global Highlight of Cancer, World Patient Safety Day, Patient Engagement in Cancer Care and Treatment, Goal of Patient Engagement, Challenges in Patient Engagement, and the most important strategies and role of nurses in improving patient engagement. Cancer. According to the research, around 25% of people with cancer have depression. A cancer diagnosis can trigger these feelings: fear of cancer, treatment, and treatment-related side effects. Simply, it would not be wrong to say that the diagnosis of cancer is not only devastating for patient health, but it is also affect all other aspects of patient and their family lives. According to the International Agency for Research and Cancer, 1 in 5 people worldwide develop cancer during their lifetime. 10 million people die from cancer globally every year. Cancer control has become one of the most significant public health challenge, which aims to reduce the incidence, morbidity, and mortality of cancer, and to improve the quality of life of cancer patients. Worldwide by continent, the cancer prevalence, around 19 million new cases of cancer were reported in 2020. Among these cases, 50% were in Asia. But if we compare this number to the population of the world, 60% are located in Asia. The estimated number of new cases in 2020 is almost 19 million, and it is expected that this number will reach to 30 million in 2040. Now, this is the patient engagement definition. Patient engagement generally refers to the delivery of information by healthcare system, and the recognition of individual preference to empower patient to act and make choices that will maximize their benefits from the received care. Patient engagement is a strategy that enables and encourages patients to be more active in managing their health. Patient engagement has gained increasing attention in cancer care as it is widely acknowledged and as an essential element of high-quality care. Patient engagement is a marker of the patient's ability to be psychologically resilient to the illness experience, and thus to be an effective owner of his or her own health journey after the diagnosis. Patients are the receiver of healthcare system. Therefore, patient engagement serves the objective of worldwide healthcare system to enhance treatment quality, which is result in better health and improved outcomes, improve patient satisfaction, reduce cost burden on healthcare system. World Patient Safety Day is observed annually on 17 September, aims to raise global awareness about patient safety. The theme for this year is Engaging Patient for Patient Safety. The World Patient Safety Day is a campaign for all stakeholders in the healthcare system to work together and share engagement to improve patient safety. The goal of patient engagement is to help individuals achieve optimum states of health through their own actions, to improve knowledge and skills of nurses, to bridge the gap between health professionals and patients, to make trusted nurse-patient relationship, to improve patient participation in treatment and care, which has numerous benefits, including effective healthcare services, enhanced quality of care, fewer adverse events, and more treatment adherence. Now, the patient engagement from the nurse perspective. Trusted nurse-patient relationship. It is fundamental prerequisite for patient involvement. The relationship is based on trust, which can be achieved with active listening and solving the concern of patient. Personalization of care. Each individual patient react differently. If we become aware of it, then we can be able to make personalized care plan for the patient and could engage them in their treatment and care. The third one is information style. It is the nurse's responsibility to make him herself aware about the patient wish, and their queries. If the nurse will discuss the information regarding the patient disease, will help us engage the patient in her care. Instead of reading on the internet, learning from families and friends, which can cause fear and anxiety. Engagement strategies. Motivating the client for active involvement in their care is the gold standard. The fifth one is the care team as a patient engagement catalyzer. It is very important to have a group of team who involve the patient in her care. Furthermore, the communication between the team is also very crucial to discuss and share the decision among the team to avoid conflicting communication with the patient. The team approach can also be helpful in discussing the patient problem and identifying best solution for them. These are from the patient perspective. Effective information. The first one is effective information. Information plays a fundamental role in enabling people to understand their own health situation. Information allows people to understand what is going on to happen, what path they will have to face, what therapies are available, and what benefits or risks are involved. People expect to be engaged through complete information. Having the opportunity to choose based on their information, the patient is able to decide for themselves. As per the culture aspect, decision-making power is delegated to the healthcare professional, being considered as a person. It is wish of the patient in the hospital to treat them as a patient, not like a number, where one feels like a stranger or unknown person. Being seen as a person is important for several reasons. It's give energy to heal, feel visible, and feel understood. Trusted relationship with nurses. In the relationship with the nurses, people have described how important is it to feel their interest and to be listened to when establishing a trusting relationship. Receiving support and advices. Patients appreciate the support and encouragement provided by the nurses, which proved to be a key in helping people to cope with their difficult moments. These are the challenges in patient engagement related to the nurses. The patient challenges are related to nurses. Our nurses are not well trained to establish tradition of engaging patient in medical courses, and are not trained to embrace clinical model which endorse autonomous and collaborative care of patients of all ages, families, groups, and communities. The main reason are poor communication skills, lack of knowledge and skills, lack of focused nursing practices, lack of proper or accurate information, limited opportunity for patient engagement. These are from the patient perspective. Age, culture, background, level of education, level of income, and personal motivation and disposition. The patient health engagement model is an internationally validated and published psychological engagement model that allows to diagnose and study the experience of active engagement of patient and its prevention and treatment pathway. PHE model is divided into 4 phases, which is blackout, arousal, adhesion, and eudaimonic. That is further divided into 3 learning domains, which is think, feel, and act. In blackout, the occurrence of a critical episode, new diagnosis, the worsening of a disease condition, and a disease relapse leaves patient to a state of emotional, behavior, and cognitive blindness. Moreover, patients feel blocked and unable to enable self-management action, behavioral freezing. In the arousal phase, patients are hyper attentive to every signal of their disease, emotional alert. They are not effective to endorse self-management strategies. In the third phase, adhesion, more advanced stage of their engagement journey, patients acquire a broader spectrum of health literacy and behavioral skill to comply with the medical prescription. In the last phase, eudaimonic project, Patients have fully accepted their condition, information is making sense to them, and adopt the practices of medical practice. These are the 5 essential of patient engagement, which is define vision, develop culture of patient engagement, educate and empower healthcare professionals and patients, invest in the right technology and resources, always be willing to adopt the new strategies. These are the strategies. The first one is the patient and families. The first step is the patient awareness, which can be achieved with leaflets, books, multimedia platforms, seminar, and workshop. The patient motivation is also having the significant impact, which can be achieved by motivational interview, problem-solving techniques, and behavioral counseling. The third is psychological and emotional support of the patient can be achieved with psychological consultation and engagement in self-help group. The fourth one is patient discussion with healthcare practitioner can be enhanced if the patient has been guided about question asking and decision aids. The last one is the patient right. The patient advocacy group need to be initiated and we should be reinforced for informed consent. This is related to the healthcare professional. Nurses need to be sensitized so they can focus on patient engagement, and this sensitization could be done with scientific literature sharing and discussion, seminar, workshops, and conferences. Nurses need to be trained so that they can communicate with the patient effectively and they engage their patient in decision making. This training could be done with clinical case presentation, role playing, and group discussion. In addition, specialty-based curriculum needs to be introduced in colleges for knowledge and skill enhancement. This is the strategies for healthcare organization. If we discuss about the strategies for healthcare organization, firstly, we need a multidisciplinary approach so that the most of the organizations start working on it. For that, we need to have interdisciplinary meeting and equipment for multidisciplinary arrangement. It would help us initiating the process in multiple specialties. The second point is what we need to continue the care by using different resources and model. For that, we need to have case manager, personalized care plan, electronic health record is also playing an important role for continuity of care. We also need to have a surveillance of the patient engagement, for which we need to check the performance and level of the patient engagement, and that can be done by using different tools, patient engagement measures, patient satisfaction measures, and healthcare cost monitoring tools. For promoting the active participation of all healthcare stakeholders, for example, patient and families and organization, clinical societies, policymaker, action researches need to be done so that its importance could be highlighted and came into practice. These are some instruments that can be used for assessment of the patient engagement. Conclusion. Guidelines are needed to ensure effective patient engagement and strategies, develop evidence-based specialty curriculum for nurses, appropriate training for healthcare professionals about patient engagement strategies, adopt standardized methodologies and tools to promote patient engagement. Research work is required on patient engagement. Thank you.
Thank you, Amir Abdullah. You have discussed about the prevalence of cancer, that is 25%, and 1 in 5 patients develop depressions. And the patient, he has discussed about the engagement of the patient, and engagement means to personalize the patient needs and give them choices, so the patient may be able to select from those choices regarding treatment plan and regarding care. And similarly, he has discussed some of the very good strategies, how to enhance patient engagement. And one of the best strategies is to first enhance the communication skills of nurses. And for that, we need to develop a customized plan related to the specialty. And similarly, motivate the patient to increase their awareness. Thank you, Amir. Thank you. So the next speaker is Samiullah, Clinical Nurse Manager, SKM Peshawar, and he will be discussing regarding redefining wellness in the workplace, oncology nurses perspective. Thanks.
Ji, Assalamu alaikum. My name is Samiullah. I'm working as a clinical nurse manager in operating room Peshawar. Today my topic is redefining wellness at the workplace oncology nurse perspective. So my topic is 180 angle, totally different from the other topic. Is not related to patient care, is not related to any policy and procedure. It's purely related to you and about your health. These are the outlines: wellness and its component, wellness at workplace, importance of wellness in nursing and its perspective from oncology nurse, strategy for redefining wellness. We will discuss our drive model, benefits of redefining wellness, initiative for wellness in Shaukat Khanum Cancer Hospital. So first of all, what is wellness? Wellness is a state of being in a good health. Wellness refers to a conscious state of health, which means the ability to keep on striving to improve ourselves to maintain our health status. A healthy outside starts from the inside. There are 8 components of wellness. Physical wellness. Physical wellness contributes to our all health and wellness. It encompasses all area of health that related to physical aspect of the body, including nutrition, exercise, weight management, engagement, etc. And it can positively impact your overall health and wellness. Intellectual wellness also contribute to overall health and wellness. It encompasses aspect of well-being pertaining to brain health and growth through promoting mental health. I'm not going to discuss all. The next is emotional, that coping effective with life and creating satisfying relationship. Financial, satisfaction with current and future financial situation. Social, developing a sense of connection, belonging, and a well-developing support system. Spiritual, expanding our sense of purpose and meaning in life. Occupational, personal satisfaction and enrichment derived from own works. Wellness at workplace. Workplace wellness refers to health promotion activity or policies that support positive employee health and behavior. From medical screening and health education, peer to fitness program and health membership, there are plenty of ways that companies can foster a culture of good health. These are some highlights that workplace wellness programs have gained importance due to their impact on employee health and productivity. As per WHO report, 12.2 million people die globally from non-communicable disease while still on work. These due to the poor work and lifestyle habit on health, is directing some of the responsibility for changing behavior to employer, which can negatively affect their health. Research highlights. Women working long hours have increased risk for diabetes, 51% chance for diabetes if they are working greater than 50 hours per week. Long work day bad for heart, 40% increased risk of fibrillation for all working more than 50 hours per week. The more hours work, the greater the risk of cardiovascular disease. If employee works 65 hours, the risk of cardiovascular disease, strokes, and cardiac attack raise up to 52%. Workplace wellness program saving costs per employee per month. The research study found that the medical costs and absent day costs fall up to $6 per month per employee. It's worthwhile to invest in the well-being of healthcare employee. For every 1% of improvement in employee retention, hospitals save an average of $373,000 per year. Importance of wellness in nursing. Nursing health and well-being are affected by the demand of their workplace, and in turn their well-being affect their work and the people they care for. For nurses to address the many social determinants that influence health, from housing to violence to poor air quality and the society they are dealing with. Therefore, they must first feel healthy, well, and supported themselves. Stakeholders have responsibility to ensure the well-being of the nurse. Nurse well-being affect patient health care system and lead to increased turnover. Perspective from oncology nurse. Working in an oncology unit can produce emotional exhausting and low personal accomplishment because of very less chance of revival of patient, always, as well as continuously deterioration condition of the patient, which lead to exhaustion and burnout in oncology nurses. Disturbed sleep pattern is also one of the factors that less than 60% of the nurses have enough sleep. So what are the strategies? A major challenging of shift work is strained and exhausting. Therefore, sleep and relaxation practice were amongst the most commonly reported coping strategy and were often prioritized. Exercising and physical activity is best way to reduce stress and maintain health. Physical activity was often mentioned in connection to socializing, sleep, and healthy eating coping practice. Diet and healthy eating can act as coping mechanism as well. And the rest like social and leisure, like social support, avoiding socializing, hobbies, and cognitive coping strategies like attitude to shift work, mindfulness, planning, and time management. Work-related coping like breaks, rostering, supervision, and debriefing, and workload. This is an interesting model. This is drive model. There should have to a pretty good balance between work demand and work resources. And if not, it may result to mental health outcome and nurses, which may be manifested as job dissatisfaction, depression, anxiety, and stress. So if you look to this model, like job demand and job resources, if they are in balance, if job demand is increasing, the result will be on burnout. The burnout will be increased automatically. If job demand is decreasing, compassion and satisfaction will be increasing. So if burnout is increasing, safety outcome like unsafe behavior, adverse event, and incident and injury will be increasing. On the other side, like job resources, knowledge, autonomy, support environment, social support, leadership, and safety climate. If all these are decreasing, burnout will be increasing. And on the other hand, if all these are increasing, engagement and patient satisfaction will be increasing. And that the same way they will affect on the safety outcome. So what are the benefits of redefining wellness? Nurse well-being has impact on nurse patient healthcare organization and society, as it can affect individual nurses in terms of physical, mental health, joy, and meaning in their work, professional satisfaction, and engagement with their job. The nurse well-being play a vital role in increasing productivity of the nurse as well as reduce the cost of medical and unplanned leave of the employee. For those reasons, nursing in much more demand than other jobs. Emotionally strong nurse can support colleagues, patient, and even supervisor. Manager investing in the nurse well-being can benefit them with low work-related stress. So, what type of initiative Shaukat Khanum Hospital has been initiated for the nurses? So, gym membership, we have a very good gym. So all employee can go there. There is a specific time for male and female, so they can go there. We have a cafe facility where all healthy food is available at very reasonable rate. Professional development strategies and different workshop. We are conducting different workshop for our staff. CMO and director of nursing meeting with the staff. There is a meeting. They directly contact with the parent, with the employee, and they listen to their problem, and then they act on it. We have a study loan program for the staff. Those who want to study, we can facilitate them with loan. We have a sport week. We are different type of games we are played for the employees. We have LFA. It means that we provide 2 weeks off with extra bonus, so you can enjoy with your family. You can go out and you can enjoy that 2 week without any stress. Employee recognition award. We also every year we celebrating employee night, where we awarded all best employee of the year. Like in each department, we're selecting staff like from nurses and other HCAs, PCO, all these, and we rewarded with cash and some prize. Wellness training, we also conducted some training. We're doing online quiz where we asking like the patient from the staff about their stress level, anxiety. Employee satisfaction survey. Currently we are working for the magnet. So there is a survey we are conducting through a vendor. There's NDNQI. These surveys are purely related to nurses. We are different type of perspective they are asking, and it is purely confidential, so they can do it online, and this going straight to the vendor, and then they give us a feedback like what their result is. We also HR is also conducting a survey for all employees, and then we sharing the corrective action of this survey in a meeting where all the staff are sitting together and we sharing all these. Employee health clinic. We have an employee health clinic where all staff can go anytime to there. If the employee health clinic is closed, then the staff can go to emergency 24/7. And last in the list, but we have a badminton court inside Shaukat Khanum where you can play anytime. We also arranging a cricket tournament, once in a year. So these all the initiative that we have taken in Shaukat Khanum Hospital for the employee wellness. To sum up, redefining wellness for nurses is not just a necessary but a moral obligation as for their highly demanding job and higher level of stress. By addressing their unique challenges and perspective, healthcare institution can create a nourishing environment where nurse thrive, ultimately leading to better patient outcome and a more compensate healthcare system. Our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. These are some picture, transport and other wellness activity. These are my references. Thank you very much.
So thank you, Mr. Smirla, for bringing this topic for purely wellness of nurses. This is true that people who are healthy and have health perception good among themselves can take care of others' health. There is again a notion which says happy nurses, happy patients. So nurses who are healthy, probably those are the nurses who will be most happy nurses, and they can keep the patient happy. So I hope the young and the more young people sitting in this hall from today now onward will start taking care of themselves so that they can bring energy and empowerment to take care of their patients. So here our plenary session ends. We have 15 minutes for question and answer session. The mics are available in the hall. Any participant who want to raise a question can come to the mic, introduce yourself and your institution, and state your question. Our own virtual speaker, Dr. Neelam, is also available for the question and answer, and she will be answering from there. And Shazeb can assist us in the questions which are coming virtually online once we have finished the question in the hall. Thank you.
My name is Harun. I work in Shaukat Khanum. My question is about case manager and caseload facilitators जो बार-बार talk में बात हुई. Do we have these in Shaukat Khanum? If not, then why not?
Currently, we do not have this position, and the case manager that is available in the European countries, they are decided for the disease, yeah, specialty wise. We have some case manager in the form of specialty nurses, that is adult oncology nurse and pediatric oncology nurse, and that is present in Lahore, SKM Lahore, but not currently in Peshawar, and that is in plan.
So we have other institutes here. Does any other institute have it? Because people mentioned that it's very commonly practiced in the Western world.
Yeah.
So
I think Aga Khan University has case managers.
okay.
Yes, Aga Khan University has.
Dr. Harun, we nursing division have taken a little step forward to develop this specialty, but that is we have started discharge planning from the units, and we have engaged unit coordinator specially trained to manage discharges of the patient so that we can manage bed. But of course, this case management and bed management strategy can be taken forward.
Assalamu alaikum. There is another question from online participant, and the question is for Mr. Amir Abdullah. As she mentioned that your topic is very important and informative, the culture aspect is very important part of the patient engagement while caring for the patient compromised by clinical nurses. Please, how can we improve?
Can you repeat the last?
Okay, the culture aspect is very important part of the patient engagement. While caring for the patient compromised by clinical nurse, please, how can we improve?
Actually, we have discussed different strategies in the end. कुछ स्ट्रेटजीज ऐसे हैं जो कि एथिकल ये कल्चर एस्पेक्ट को कवर करते हैं, जैसे हमारे जो पख्तून कल्चर या डिफरेंट जो कल्चर होते हैं उसमें फीमेल को स्पेशलिटी उसको इन्वॉल्व करने में फैमिली जो है वो इतना वो रिलेक्टेंसी शो करती है. तो और जो पीडियाट्रिक और जीरियाट्रिक पेशेंट है हमारे कल्चर में उसको भी वो इतना एम्पावर नहीं करते कि वो अपनी फीलिंग या उतनी जो हेल्थ स्टेटस है वो रिपोर्ट करे हेल्थ प्रैक्टिशनर को. तो वो जितनी भी हमने कहा कि हम अगर स्पेशलिटी बेस्ड प्रोग्राम फॉर नर्सिस शुरू करें और जिसमें नॉलेज और स्किल इसकी इम्प्रूव कर ले ताकि ये कम्युनिकेशन बेहतर हो जाए. द रीजन इज कि जितना आप कम्युनिकेशन इम्प्रूव करोगे उतना ही वो इन्वॉल्व होंगे, इंगेज होंगे और दे कैन डिसाइड फॉर देयर ओन हेल्थ.
Assalamu alaikum. My name is Mehran Khan, and currently I'm working as the Director of Nursing in MTI Sawabi. My question is from the all panel, and specifically from the Dr. Rihana Panjwani, that we always compare our nurses with the Western nurses. Can you please tell me, I don't say that we don't have a capability like a Western nurses, but can we compare all the gaps and all the facilities in Pakistan with the Western nurses? So please, can you elaborate?
Mr. Rihana को mic दे दीजिए, please.
Very interesting question. I'm so happy that you brought it up. Yes, of course. हमारी facilities भी ऐसी नहीं है जो हम higher income countries से compare करें. I agree. हमारी education भी नहीं है. हमारे local, इसीलिए there are standards for lower middle income countries which is different than higher income countries, right? So why do we compare with higher income countries? Because you have to have some benchmarks. You have to look up at to something. Like we discussed case managership, right? We need to understand where it was coming from. Case managership, जो ये role था, it was derived from advanced nurse practitioner, जो कि Western countries में बहुत सालों से था, and it is very effective. So AKU started this like 20 years back with 7 case managers and trained in subspecialty. We are still behind that. You know, many hospitals did not have human resource to allocate. Yeah, आपका retention इतना नहीं था, turnover nurses का इतना था. Like we spoke to Rihanna also, that you know frequently nurses are moving out, so we cannot retain nurses and train nurses for the specific roles. Our PNCs is still struggling to get the advanced nurse practitioner getting in on board. So yes, we cannot compare that, but we need to have some benchmark. Lower middle income countries ke liye benchmarks are lower. But if you look at the burden of cancer, it's higher in lower income countries. And to decrease the gap of mortality from higher income countries to lower middle income countries, we need to step up our game. और हम हायर इनकम कंट्रीज को इसलिए देखते हैं कि बिकॉज वी डू नॉट वांट टू रीइन्वेंट द व्हील. उन्होंने वो काम कर चुके. लाइक आई सेड कि 1950 से उन्होंने शुरू किया तो दे हैव डेवलप्ड. नाउ ऑल वी हैव टू डू इज take adopt those things which are working. And it's not just we have to do the same as higher income countries. We have to understand our limitations, and we had to adopt things which works in our society. But nursing is something which we are all here. We have to step up our game. हमें भी आगे जाना है. We have to identify roles. We have to have competencies. We have to understand where our gaps in. And this is how you are going to do it, by comparing and knowing that what others are doing and where we can, step up our game and, do something to improve ourselves.
It's actually
I hope I have answered.
Defend Rihanna here. It's not a matter of comparing. We do not compare.
Yeah.
But yes, where there is a pair, it is always compared. The examples are brought to bring motivation and to bring inspiration that if other part of the world things can happen, we can do it. And as Rihanna said, that we have different culture, we have different genetics, we have different education system, but within our system, we can bring it. So it's not comparison, but it's bringing role model to enhance our understanding and to start working for our country. Thank you, Rana.
Yeah, thank you. Just one last comment. If you remember, I gave you 3 case studies from prevention role model. They are all from lower middle income countries. वो सारी nurses थी जो lower middle income country में थी या lower countries में थी, और वो examples वहाँ से थी. एक India की थी, एक Tanzania की थी. So they are not high income countries, but they are doing it, right? So why can't we? Just thank you.
And we have a lot of talent. We can do it. We can always, like Sami have brought this from the Pakistan perspective, taking care of yourself to bring energy to take care of others. So yeah, we can always do things.
There is another question from online participant as well as from Ms. Faryal, which is currently working in chemo department. The question is for Dr. Neelam. That what are the challenges of nurses in the delivery of care in the digital manner in Pakistan? Should I repeat the question?
I know it's good. I just want to know if you can hear me properly.
Yeah, we can hear you.
Okay, perfect. So that's a great question. And when I was, preparing this presentation, that was in my mind that somebody will bring up this question that in Pakistan, is it possible to bring digital therapeutics or not? It is possible, but I think as Dr. Rihanna has mentioned very clearly, we are taking lessons from West. So we are not comparing, we are just taking lessons. And I think in terms of digital therapeutics, maybe we cannot go very much advanced in terms of bringing everything that Western digital people are doing. But at least, in Pakistan, I know like every person has a mobile phone. Young people, old people, and then, these are the apps that you can always, just we can have it in our own language, Urdu. So it's not been long that I have left Pakistan. I have been there, for my whole life. I left Pakistan 6 years ago, so I know, we have availability of internet, and we also have availability of phones there, and people are like very much into phones. So digital therapeutics, but the challenges could be, again, the literacy rate is not very good if we talk about the remote areas of Pakistan. If we talk about a lot of people, not everybody is educated. But here the point is, so 6 years ago when I left Pakistan, I used to work with Khan Development eHealth Resource Center, and we had developed an infrastructure for telepsychiatry. So in telepsychiatry, again, psychiatry is a field where, it's not very much well known. In terms of people, mental health is a taboo topic, right? So not everybody is just going to the clinics and talking about their mental health. So nurses were trained in Gilgit-Baltistan, and then there was an infrastructure where they used to come, and then they were doing the teleconsultation because there were no psychiatrists available in those areas of Pakistan. So again, when I'm talking about digital therapeutics in cancer care, so that means that because the nurse patient ratio and doctor to patient ratio is very much different than what it should be. So अगर हम कहते हैं कि 5 मरीजों के लिए एक नर्स होनी चाहिए या 10 मरीजों के लिए एक डॉक्टर होना चाहिए, तो हमारे पास शायद 1000 मरीज होंगे और एक कैंसर का डॉक्टर होगा, तो आप उसके लिए क्या करेंगे? तो हर कोई अगर इमरजेंसी जाएगा छोटी छोटी चीजों के लिए, then we cannot cater the big population that we have in Pakistan. So digital therapeutics can create that bridge between so many things, जहां पर हमारे पास एक नेटवर्क हो, जहां पे हम देखें कि भाई मरीज को ये मसले हैं, so मरीज को हम directly रेफर करें. But again, the challenge is, do we have this in Pakistan? क्या हमारे पास वो navigation system है? And again, it actually takes us to all the presentations that we have just heard. कि हमें इन चीजों के लिए भी मेहनत करनी है, कि हमें केस मैनेजर चाहिए, हमें नर्स नेविगेटर चाहिए, जो patient को not only with the physical aspect देखे, but they also look patient as a whole in terms of looking at taking care of their emotional health, psychological health, physical health, because cancer is something that is not only physical disease, but then the patient needs a lot of other things. So the digital therapeutics can be a bridge that can help patients or that can help the healthcare professionals to decrease their burden. I hope I have answered the question.
Thank you, Dr. Neelam. We have a question from the hall, a gentleman standing in front of Mike, and this could be our last question because our time will end after this.
Bismillahirrahmanirrahim. My name is Zahurul Islam, and I am a second 4th semester student from Northwest College of Nursing. As we have been allowed to work as a nursing practitioner, so my question is that up to what limit we are autonomous that we can work as a nursing practitioner? Our nursing practitioner will be still limited to the care, or he or she can work to treat the patient in efficient way? And what is the basic difference between nursing practitioner and medical practitioner? And thanks. May I repeat the question?
No, we understand your question. Mr. Hana is going to answer. She is saying.
Yeah, thank you so much for the question. So I just explained you that advanced nurse practitioner is a master's level degree, right? PNCs is still struggling to get the things done. I just heard a couple of months back that PMD se na approve kar diya hai. And there is a whole process of it. Like, pehle licensure approve hoga, PNC approve karegi, then the program will start it. I also heard that AKU has also developed a curriculum to start that masters. That would be specified masters. Now, if you look at the Western world, they are licensed. जैसे मैंने अपनी presentation में बताया था, उनके पास हर चीज का license होता है. अगर bone marrow वो कर रहे हैं तो उनकी credentialing होती है. Advanced nurse practitioners का license होता है. They give exams and then they are allowed to do this, right? In Pakistan, we are way behind. पहले तो उनकी पढ़ाई होगी, उनकी credentialing होगी, फिर उनकी license, जैसे line practitioners हैं, जो सिर्फ line care करते हैं. मगर उनके credentials होते हैं. They have to make sure that they have, you know, just example के उन्होंने अपनी competency based training की है, 100-line insertion की है, they are certified to it, and then they are independently doing it. In Pakistan, we don't know PNC क्या licensure रखेगा, क्या credentialing रखेगा. जब वो we will have that process on the papers and everything then done, then we'll be allowed to work as a nurse practitioner like in Western countries, and then probably nurses will be allowed autonomously, independently doing all that stuff. The thought is still far-fetched कि हम कब ये सब कुछ कर सकेंगे, but it is on the process. The process is in. So hopefully sooner we will do. Until then, in my personal opinion, maybe others can say that, I would not recommend nurse to independently start doing things. ठीक है? क्योंकि हमारे पास कोई credential नहीं है, कोई license नहीं है. Right? You know, if you are stuck in something and if there's some malpractice, then we'll all get into trouble. So let's better start and wait until the whole process is done and we get licensed to do work in autonomously.
So-
Hopefully it will be done.
So very well said, Rehana. Nurse practitioner is a specialty and it requires MSc level nursing. Before that, you should have experience in that arena where you want to specialize and become practitioner. But as you said, independent nursing practice, so as a student, you might have been studying that in nursing, there are independent nursing intervention, which nurses can do. And there are collaborative intervention where nurses carry the orders which are placed by the doctor. But in that, even nurse is independent if he or she has a competence to do that. So, for example, the nurse who is administering chemotherapy is administering chemotherapy independently after doing those competence. But yes, the prescription comes from the doctor. And all those management of post-chemotherapy is done by nurses, educating the patient, telling them how to live their life, how they're going to take care at home. So the practitioner, as per practitioner, is a novice concept in nursing. So here I will close the session saying thank you very much for all the participants coming from all the institutions of Shaukat Khanum Peshawar. And I'm sorry, people were a little bit late, but the culture of Shaukat Khanum is to start things at its planned time. So we started in planned time. We're finishing in planned time. The continuation of nursing session is tomorrow at 9 o'clock, nursing session 2. And I will again wish that everyone who is here today is here tomorrow, but please be in time so that you can enjoy what you are coming here for and you can serve the purpose. Thank you very much.